Good afternoon, everyone, depending right from across Canada, depending where you're joining us from. We would like to begin with an acknowledgement today that N4 is hosted at CHEO, which is located in Ottawa, Ontario. And Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Mariah, and I am a project coordinator on the N4 team. And I'm joined here today with two of my colleagues, Dr. Zahar Zoni, who is a project co-lead for the N4 National Newcomer Navigation Project, and Andrew Tolmeyer, who is N4's education coordinator. And Christine Khoury is also N4's project co-lead, but needed to send her regrets today, unfortunately. And Andrew's also experiencing some technical issues, so he may appear during the presentation, and he also might not. So in that case, Zahar and I will cover Andrew's slides. So we wanted to start off today with a poll for you, and we wanted to ask if you have heard about N4 before. It looks like most of the people here have not heard about N4 before. So that's really great. So for those of you who are unaware, N4 is a national network for the diversity of providers who assist newcomers in navigating the complex Canadian healthcare and social service systems. And we provide opportunities for professional development, education, virtual discussions, networking, and the sharing of data and resources. And we aim to promote best practices in the field of newcomer navigation, with the ultimate goal of improving the experience of newcomers to Canada. And currently, our network is comprised of over 700 professionals from diverse sectors across Canada, including the territories, and we continue to welcome new members every day. So for those of you who haven't heard of N4, hopefully by the end of the presentation, you'll be quite familiar with what we have to offer and consider joining the platform. So today we have no conflicts of interest to declare. In terms of engagement, please feel free to put your questions, your answers, comments, or reactions in the chat box. And we've left time at the end of our presentation to address these. And with that said, I'm going to get right into sharing findings from our most recent report on our outreach and engagement. So we know, and it's been spoken about in the conference, that the dual pandemic of COVID-19 and the racial justice movement have highlighted the vulnerabilities of newcomers. Over the past year, many organizations made commitments to improving equity, diversity, and inclusion, but have struggled to actualize real change. So from April 2020 to January 2021, my colleagues and I personally engaged virtually with over 40 organizations across Canada to better understand their experiences as they supported newcomers navigating the health and social service systems. Today, for the first time, we will be presenting brand new findings from our report, including challenges, barriers, successes, and innovations. And we'll discuss how N4 is applying these findings to better support professionals like yourselves in advancing equity, diversity, and inclusion across Canada. So some of you may be familiar and may be aware, we might have met with you, but in July of 2019, N4 set out to better understand the experience of professionals across sectors as they support newcomers navigating the health and social service systems in Canada. And following a very robust period of outreach and engagement, where over 150 organizations were reached, N4 launched an integrated platform, newcomernavigation.ca, and began to welcome professionals across Canada from the health, settlement, and social service sector to its platform. And shortly thereafter, N4 prepared and shared a report on key findings. The report was called Newcomer Navigation from Coast to Coast, Report on Outreach and Site Visits, detailing key themes that were apparent in research activities. And we spoke about how N4 was applying these themes. And so following the release of this report and N4's initial outreach and engagement, N4 continued to engage with health and settlement organizations and government-assisted refugee cities to ensure the N4 platform was appropriately meeting the needs of its diverse member base and to continue to understand professionals' experiences supporting newcomers as they navigate the health and social service systems. This time, however, the focus was on engaging general hospitals community health centers, and settlement organizations in government assisted refugee cities. And as you can imagine, this engagement was particularly timely as organizations across the country were all faced with responding to the pandemic and continuing to provide essential health and social services to their newcomer clients and patients. And as a result of doing engagement during this period, N4 was able to identify key challenges, barriers, and promising practices that affected newcomer navigation during COVID-19. So as we did our virtual site visits, we had three key objectives. The first was to curate and mobilize knowledge and to understand the gaps that professionals were experiencing as they were supporting newcomers navigate the health and social service systems. Our second objective was to foster connections, learnings, and collaborations among professionals across sectors across Canada. And we did this by inviting professionals to join our online integrated platform and become a member. And then three, we also solicited potential candidates to join cohort 3 of our online certificate program in newcomer navigation through St. Paul University. And we also sought out expressions of interest for our fourth cohort. So those were our three objectives, and I'll go to the next slide. And so from April to January 2021, we engaged virtually using Zoom with organizations in the health, settlement, and social service sectors from a total of 5 provinces and 1 territory. And we engaged each time professionals in a facilitated discussion to better understand their experiences. And during each visit, we asked 8 consistent questions and took some notes, which we then shared back with the host organization. And once these notes were validated, we put them into NVivo and began doing a bit of an analysis on the notes from those site visits. So in total, N4 met virtually with approximately 171 professionals from the health, settlement, and social service sectors. So these professionals worked at over 41 organizations from the health, settlement, and social service sectors across Canada. And that was inclusive as well of the territories. And these included professionals working in a variety of diverse settings, such as hospitals, community clinics, settlement organizations, among others. And because this was happening during COVID-19, of course, these took place virtually. So we want to also mention that the key themes that we're presenting today report a lot of the successes and challenges that at the time were being experienced by organizations who were supporting newcomers during the dual pandemic. In our needs assessment, one of the questions that we asked was what was the impact COVID-19 was having on providing services to newcomers. And as we've heard in the conference, we heard from several organizations that social and health inequities among their newcomers were exacerbated during COVID-19 and that they saw intensified structural inequities. And this was attributed to a lot of cultural and linguistic barriers that newcomers might experience, as well as Canada's healthcare system and social system is very difficult to navigate. So those new to Canada may also, it might be challenging as well, being a newcomer and having to navigate the system coupled with cultural and linguistic barriers. And during the first wave, several organizations noted that they were offering their services in a different way, leveraging technology and virtual platforms to connect with their clients. And these included Zoom, Microsoft Teams, Google Hangouts. We also heard that some organizations were seeing increased demand for their services and higher caseloads as a result of some of the impacts of the pandemic. And there was one social service agency in a remote northern community that reported the pandemic had resulted in job loss for their newcomer clients. And as a result, they were doing 5 times the number of interventions to support navigation post-job loss than they had previously. And we also heard that food insecurity was another need that arose during the pandemic. And among some of the challenges, we heard a lot about virtual care. And a lot of organizations reported that they adapted really quickly during COVID-19 by shifting their services to online modes of service delivery and having staff begin working from home. And some organizations continued throughout the pandemic to deliver their services virtually, and others resumed between waves in person. But this really seemed to vary province to province based on the type of services provided and each province's public health orders. Some organizations reported that they felt more poised between waves to deliver or after the first wave to deliver services online because they had done so previously in the first wave. And we also heard that some organizations pre-COVID were actually exploring virtual modes of service delivery, and that the pandemic was a catalyst to begin providing services in this form. One of the things that came up as a challenge was really around equity in virtual care. And there were some participants reported their newcomer clients and patients weren't able to access the technology necessary to access the online services they were providing, as well as other services or applications that they were applying for through the government. And some noted that in multi-generational families, if there's not enough devices for everyone, it was also a challenge to get everyone on with a device to get online. And as well, several organizations reported that digital literacy among their newcomer clients was sometimes low, and that their patients and clients required extra support when using technology. And to mitigate some of these challenges, some organizations were advocating to buy computers for their newcomer clients and patients to help them access the services they needed. But really, there's no one size fits all approach to virtual care. And there was one organization that shared some concerns about the provision of virtual care for refugees, noting that while virtual care presents opportunities for service continuation, it's not always appropriate for newcomer families as they may experience some challenges with navigating this technology. And it's just important to consider the appropriateness of virtual technology based on their clients' and patients' needs. We also heard a lot about the impacts of provincial lockdowns. Several organizations shared that lockdowns were challenging for their newcomer clients and patients. Social isolation was shared as a challenge for newcomers during the pandemic. And one organization reported connecting to stay in touch with their clients to really let them know that they were there for them, even though their in-person services weren't happening. And there was one, we met with quite a few mental health providers who shared that, and one of them explained how mandated lockdowns could be triggering for some newcomers. And they gave the example of panic buying of food and preparing to not being able to leave their homes, maybe a reminder of the calm before the war, where people prepared to be able to survive in their homes for a really long period of time. We also heard a lot about newcomer-specific communication strategies, and this appeared to be both a strength and a challenge, especially during COVID-19 communication plans. Some had strategies that considered newcomers and others didn't, and it really seemed to vary province to province if newcomers were considered a vulnerable group to COVID-19. And some participants noted that there was not as much community recognition of newcomers as a vulnerable group, which could have been the result of a lack of awareness due to data not being collected for newcomer populations. And this likely impacted the communication strategies if those were apparent in the COVID plans. We also heard one organization share that their organization was using Facebook, Instagram, Twitter, and their webpage to disseminate information, but they acknowledged that while these sources were working for their organization, they may not necessarily be working for newcomer communities. And we know as well that there's been amazing organizations like Refugee 613 who have been bridging this gap and leveraging technology such as Facebook and WhatsApp to disseminate multilingual resources to newcomers and newcomer serving professionals. And we heard that several organizations were accessing those resources. We also heard about a lot of great innovations across sectors to support newcomers. There was one organization from the health sector that had developed a virtual emergency department that diverted 700 people from the ED. And we also heard a lot about settlement organizations coming up with innovative ways to reach clients who might have previously taken the bus to their organization but were unable to during COVID-19. We heard a lot about language classes being offered online and food delivery programs being initiated. And there was, some organizations did report being concerned about the sustainability and continuity of initiatives that had emerged during COVID-19 because additional funding had been received to provide this type of programming. And they weren't clear if this funding would continue after COVID-19. And again, In terms of lessons learned, several participants noted that while COVID-19 presented challenges, it also provided the opportunity to look into different modes of service delivery and allowed for innovation and creativity. And of those who participated, several were piloting new projects, adapting and innovating their programming in creative ways to meet their newcomer clients' and patients' needs. And one organization even reported that they were doing more frequent check-ins with clients through surveys to see how their organization was meeting their needs and where there might be some gaps. So I'm just going to now pass it over to Sahar, and Sahar is going to go through some of the other key themes that we found around newcomer navigation.
Thanks, Mariah. And I would like to start by just saying thank you very much for everybody who participated, all the organizations that gave us a lot of their time, the staff we met with virtually, who still during a very challenging time like a pandemic, right, were still eager to meet with us and answer a lot of our questions that really helped put together this report, but also helped a lot with our what's next for N4 and what should we be working on. So today we're just sharing the themes with yourself, but we're also going to be sharing what N4 has put in place to really action some of the things that were requested or were desired from the healthcare and the settlement sector. So first talking about the challenges that we heard from the settlement and the healthcare sector, one major challenge was around the access to language and interpretation services for newcomer patients and clients. And that was noted as a significant challenge for providing an equitable health and social service to the clients. This challenge was noted in our phase 1 report that Mariah talked about, which is available on our website, newcomernavigation.ca. And at that time, when we completed the first report, there was no COVID-19. So you will find that there will be similar challenges, but I'm sure that the COVID-19 pandemic had highlighted a lot and have really, maybe some of the shadowed challenges that did exist. COVID-19 did help make it more complex and more compound. Organizations shared that personal protective equipment such as the masks and the use of the virtual technology created a barrier for providing interpretation services. Overall, we found that interpretation services varied from province to province. There was a lack of consistency in terms of what type of interpretation services were accessed across jurisdictions and sectors. Some organizations reported using a language line and an in-person interpreter. Others reported, in the absence of these services, having to rely on the newcomer family or friends, and or even using the translation app like Google Translator. It was acknowledged, though, that using the, either the family members, sometimes even children, or using the apps was really, as a mode of the interpretation, represented some ethical dilemmas and was not appropriate for providing healthcare to newcomers specifically. This systemic barrier is further compounded for newcomer patients. Some reported, especially for the French speaking providers. So one organization, for example, shared that for a French-speaking health service provider who tried to contact the language line, the correspondence was in English, which really was not very helpful and made it very difficult for them to navigate. Another major challenge that both sectors faced was around the, and was found actually across many provinces, was that many had a challenge with the accessing primary care services for the newcomer families and clients. And this was really due to the lack of the primary care providers in the community. We heard from many of the refugee and newcomer clinics that their services was actually intended to be limited. So some would go for maybe ranging from 6 months to 2 years. But as a result of this lack of the primary healthcare providers in the community, there was a difficulty in transitioning those families to the family doctors and primary care providers in the community, which created like a kind of a backlog on those clinics. This was further compounded as some of the primary care providers were reluctant to take on an entire newcomer family. They prefer to have just the one single patient, and it even became more and more complex if they needed interpretation services. Again, because of the lack of the interpretation services or the financial demands on the primary care provider. Another challenge was the information sharing pre-arrival. So the organizations from the health sector, they shared that they were not adequately able to prepare for the complex patients. And usually, as we all know, our newcomer families, clients and families, they usually have a lot of complexity. And due to they were not able to prepare, and that was due to the lack of information sharing regarding their health needs prior to arrival. In acute care settings, professionals desired to learn more about the support the immigrants and refugees receive as they are coming to Canada, and how it is determined which communities newcomers will settle in. Again, that was very vague for them. Like there was a kind of a gap between the decision taken to settle some of our families with complex needs in certain cities and who is making these decisions and how these decisions are made. They also shared knowing what is covered and what is not, and what's available for these families would have really been helpful in making decisions for their treatment. Two of the hospitals noted that having information from IRCC about medical conditions pre-arrival would really have helped them prepare and coordinate services required in advance. In some cases, the newcomers would have very complex need, and they would still be settled into a smaller rural or an urban city, which is not equipped to receive some of their demands. And I'll give you an example, that one hospital shared with us, where a family was settled in a province where there was not available a pediatric hospital. And the family had a child who had chronic renal failure and needing dialysis. And for the healthcare sector, for the pediatric hospital to be able to provide that, they had to coordinate with the settlement sector to make sure that the child was actually flied into another province that has a pediatric hospital 2 to 3 times a week, right, to get that dialysis done in another province, in a pediatric hospital in another province, which created a lot of challenges on both sectors, of course. Another challenge was the ethical dilemmas. So having to deal with a lot of ethical dilemmas as they help the immigrants and refugees settle in, such as getting informed consent, right? And getting actually acute care settings in a short time frame were not adequate. So lots of ethical dilemmas that they had also to face in the two sectors. Another challenge was the disjointed or fragmented health and social service systems. So organizations from the health and the settlement sector, they shared that newcomers have complex social and health needs that cannot be met by one service provider on their own. So partnerships across the sectors are essential for providing a wrapped around services and meeting the social and the health needs of the newcomers. Participants reported that a lack of the established partnerships among the health and the settlement sector was a barrier to providing equitable health care to newcomers. When these partnerships were pre-established, newcomer experiences were very seamless, and there was a real transition between services. Another challenge was the resources and capacity. And here in the healthcare sector, participants, they shared that the needs of newcomers, particularly the newly arrived refugees, were very specific and intensive. Several from both sectors alluded to the myriad of trauma refugees have experienced. Many also shared how the lack of available language and interpretation resources, as I mentioned earlier, was a challenge that impacted the quality of the services they were able to provide. As a result, many shared that staff themselves were experiencing a burnout due to the resourcing and capacity challenges. Furthermore, some professionals, especially in the settlement sector, they have lived experiences as newcomers themselves and may become re-traumatized. So vicarious trauma and compassion fatigue were noted by several organizations as challenges that were attributed to a lack of resources and capacity challenges to appropriately provide the support newcomers required to navigate both systems. This challenge was further compounded during the COVID-19, of course, as newcomers required additional time and support navigating both systems, utilizing virtual technology and accessing information to understand what is covered by newcomers versus what's not. After sharing the challenges, we asked them what were their strengths, and we were very happy that they shared a lot of strengths. So lots of positivity there, and definitely there's always that will to help and make sure that newcomers to Canada, they are well settled and they're having a lot of their services and their needs met. So navigational support and warm handoffs was a major strength, as newcomers often they have those complex needs that require multiple touch points with the health system and may require additional time from the service providers and resources. So many organizations reported that having a position devoted to supporting newcomers, such a newcomer navigator, for example, in the organization, or a similar role in many organizations, we heard how the social workers, how the case managers carry that role of a newcomer navigator was very helpful to support the warm handoffs and for liaising with the partners who provide the services outside the scope of an organization that a patient or a client would need access to. A commitment to among organizations to equity, diversity, and inclusion work. So several shared that their organizations had embedded equity, diversity, and inclusion within their strategic plans and made commitments to that work. Within the healthcare sector, some hospitals had dedicated health equity and or diversity and inclusion specialist roles initiated, aiming to ensure that the services provided and the workforce within an organization is reflective of the community needs. These organizational commitments and subsequent EDI initiatives bettered the support to those racialized and marginalized populations, such as the newcomers, and ensured that they would have an equitable experience accessing the services. The diversity of the staff, again, one of the main strengths is that we heard along our journey completing the needs assessment since phase 1, since early June of 2019. So was really outstanding, especially during the COVID-19. So having the diverse staff who have diverse cultures and can speak a lot of languages was a strength that supported many organizations that provide services. Participants also shared that staff who got hired, who can identify with the community better, understand the needs of the newcomer clients and patients. Having staff who spoke multiple languages even was an asset for multiple organizations and kept them connected to the local community and gave them, especially during the COVID-19 with all its challenges, understanding of the needs of the clients and built those trust relationships and for providing the health and social services to those clients. Several of the organizations from both the health and the settlement sector also reported hiring staff, including clerks and case managers who spoke the languages other than English or French, which really became very prominent, especially during the COVID-19. And again, with the different phase waves of currently, for example, the Avrain resettlement. multidisciplinary team and wraparound services. So newcomers navigating the health and the social service systems often have the complex needs, and they cannot be met by an organization on its own. So several organizations have formed those multidisciplinary teams of nurse practitioners, dietitians, a physician, and a family resource specialist. So the organizations that had those multidisciplinary team were really very well set off to deal with the multiple needs and complex needs of these families. And we've seen a number of organizations, especially hospitals and settlement organizations, who had this type of structure around multidisciplinary. The use of a strengths-based approach. So when discussing strengths, the organizations from both the health and the settlement sector frequently shared how the resilience and the resourcefulness of the newcomers really stood out as a strength to them. And they had one organization reported creating what they called an empowerment action plan that take into account the strengths and the resources of their clients. And these protective factors were considered alongside their current needs. It was also noted that having newcomers as part of the navigational process itself was important, because they will become a resource to help themselves, and they would relay information to the others in the community. We also looked at the current education that's available for staff and resources. And so several organizations, they shared that on an ongoing basis, maybe yearly, they would look at their learning needs and what are the gaps within. And then they would subsequently identify local opportunities and or organizations who could provide training on these topics, commonly offered ones, such as ones around how to support LGBTQ or newcomers, how to build those bridges with the indigenous population. As well, several professionals, they relied on their own internal and external networks to peer and peer-to-peer support. And they would be seeking these educational opportunities and resources, and would bring them into their organizations. Organizations also refer to having access to mental health. So we found that mental health and the need for resources was something that always came up in our discussions with organizations in the health or the settlement sector. And the KMH's Immigrant and Refugee Mental Health Project, which is funded by IRCC, was one of the most common programs that was actually accessed by the professions in the settlement sector. Organizations shared also that they access webinars, and during the COVID-19, there was a lot of webinars being offered by organizations, which is one of the advantages of having this online virtual life that we're living on. And so it was really accessible for them to access many of the educational opportunities out there, as providers put them on their online platforms. Professionals working in the settlement sector also reported accessing settlenet.org for a lot of topics such as vicarious trauma, to working with the different communities. A couple of professionals, they noted involving people with lived experience or partnering with local ethnocultural community leaders. It can be very effective and to inform their staff about the complexity of navigating the health and the social services. Some refer to the use of the local service directories such as 211 or 311, were also very accessed by professionals, and they found a lot of local community resources that their clients can access. What about the desired resources? So So among the desired education and resources, e-learning resources, organizations expressed a need for training on trauma-informed care and trauma-informed approaches to better support their newcomer clients and patients. As well, several organizations desired training and building capacity in areas related to racism and discrimination, cultural competency, and racial stereotyping. Some organizations were seeking resources related to COVID-19 and lessons learned from organizations as they supported their newcomer clients during the pandemic. It was really very interesting to hear from some professionals in the settlement sector how it would be helpful to have a culture profile for the countries newcomers are arriving from. So they had a better idea of what their cultural norms might be and what to expect. We heard that IRCC was actually doing that at some time, certain time, but they would love that to come back again. Having resources and information in an easy to navigate format in one place was also shared as being something very valuable, and it would really be helpful for them. Another question that we asked them was around the data and what data they are currently collecting. So, the data currently collected by organizations from the health and the settlement sector on their newcomer clients and patients really varied depending on which programs were offered, the type of the database used, and reporting requirements to the funder. Settlement organizations with refugee assistance programs, the RAP programs, they use the client support services efforts to outcomes, the ETO database, to track the outcomes among the refugee clients through the RAP program. On the other hand, when we look at organizations within the healthcare sector as hospitals, they collected a lot of the socio-demographic data, such as the gender, the date of birth, the age, education level, and language level, through their electronic medical records. So you can see there is a variation there. Organizations from the health sector that did not exclusively serve the newcomers often did not report tracking of any of the data that for the patients that would denote that they are newcomers. For public data, many reported turning to credible sources for data such as the Statistics Canada or the UN, the Metro Vancouver, and ISS4 of BC, and among other federal and provincial research institutions, umbrella organizations, to access data to better understand the needs of the newcomer clients. Another source for public data was the conferences, such as the one we're currently in, the P2P conference. It really played a crucial role for them, and together with websites like settlenet.org, where they accessed a lot of, was really referenced as being accessed by a lot of the settlement sector organizations for resources and current data. What's their need? So asking them about their needs, overall, there was kind of a hesitancy because the way that there wasn't a consistent mechanism among the different organizations on tracking data about the clients and the patients. And it varied, as I've just mentioned, among the healthcare and the settlement sector. So the dual pandemic of systemic racism and the COVID-19 prompted many organizations to begin looking into collecting the socio-demographic data for their patients, their clients, to address the inequities within their organization. This was timely as several organizations, particularly within the health sector, were renewing their focus on health equity, diversity, and inclusion, and exploring race-based data collection within their organization. Multiple community health centers reported that although they collected data through an electronic medical record, they did not feel that they were fully using it in terms of generating disaggregated data reports on their newcomer patients that could support organization and program improvement to better service their patient populations. So all to say, the data is there, but what are we going to do with the data? So there was a desire in the healthcare sector in using this data from the electronic medical records to better understand which conditions were being seen, greater presenting needs, and what other resources are being needed. Staff from the settlement organization desired that they would like to access some of the disaggregated data from their local health partners to better understand the health needs of newcomers in their community and use this to inform their programming and organization policies and practices.
So we heard from a lot of different organizations that that they partnered with a lot of other organizations to support their newcomers, clients, and patients' needs. And among the health sector from those organizations that we engaged with, we heard they often referred to internal allied health partners and multidisciplinary teams of professionals as being a really strong partnerships and really essential for providing wraparound services to their newcomer patients. And then among the settlement sector, we heard about quite a few different types of partnerships. Often strong partnerships were reported among the education sector, specifically with settlement workers in schools, with community-based mental health services, social services like housing, child protection, and employment. We also heard professionals in the settlement sector having partnerships with local mental health clinicians in private practice and justice services such as legal services, as well as local religious community leaders. And a lot of organizations, specifically those in the settlement sector, reported participating in cross-sectoral planning tables like local immigration partnerships, multicultural networks, as well as some COVID-19 response planning tables. And they reported participating was really beneficial for their organization and connecting with others. But what we did hear is that a lot of stakeholders that we met with from the settlement sector voiced a desire to build stronger partnerships and relationships with hospitals and public health. And that seemed to be really apparent, and I think especially because it was during COVID-19 as well. So altogether, there's a lot of information that we've shared here, a lot of information that we've collected. And I do encourage you in the chat, if any of these findings resonate with you, or if there's something that we might have missed, please feel free to put your comments in the chat or your reactions to these findings. But we did see kind of just 4 main takeaways: that social and health inequities among newcomer populations were intensified during COVID-19. We continued to see access to language and interpretation services in primary care as a significant challenge that's perpetuating health inequities among newcomer populations. And in just a moment, we'll share some of the things N4 is doing around that. And we also heard from a lot of organs from both the health and settlement sector that they understood the importance of collecting socio-demographic data. And there was a really big desire to explore how to integrate and use this data to help to inform their equity, diversity, and inclusion initiatives within their organization. And overall, cross-sectoral collaboration between the health and settlement sector is of critical importance, especially as organizations are now focusing on embedding equity, diversity, and inclusion into their organizational policies and practices. And we know that often newcomers have complex needs that cannot be met by one service provider on their own. So those partnerships are particularly important to ensure that newcomers, as they're navigating health and social services, are able to access the additional support that they might need to have an equitable experience. And so that concludes our report. I did see a question in the question and answer box around if this report is available on our platform. Currently, our first report is available on our platform, but the findings that we are sharing with you today are hot off the press. We haven't shared them before, and the report will be available on our platform very soon. So I encourage you to sign up, become a member if you haven't already, and you will probably receive a notification in one of our newsletters or communications when the report is posted to our platform. But I'll just go to the next slide, Sahar, and maybe we can share how we're using these findings.
So as we mentioned, like the needs assessment has really guided all our activities, and for many of our activities had already been, part of our structure to what should we deliver. But definitely, it really filled a lot of gaps and brought that knowledge to us. So, for example, the learning framework, which is, we built the whole structure of what we are delivering when it comes to education, and providing resources around the learning framework that we structured, or we actually got from the needs assessment. So you will find that always we are trying to have resources there that would make sure that there are opportunities for learning from others. So from we do not need to reinvent the wheel, but also opportunities for collaboration. And we target through our webinars, that we'll talk about in more details, our professional development. We target lots of the topics that we heard from the needs assessment around the health topics, the settlement topics, also special professional development opportunities, and the topics around immigration and immigration resources, and special population. On the website or the integrated platform, we have curated a lot of resources through our resource toolkit, and lots of e-learning. So we really, in the beginning, we did not want to reinvent the wheel. We just wanted to make sure that, as we heard from our site visits, they wanted a one-stop shop. So really a resource tool where they can go and they can search and find the articles, the pamphlets, the brochures that they need. So to date, we have more than 1,000 online resources on the website. And we've always been very keen to have French resources. So 15% of those are French. We're always asking our subject matter experts to meet with them to provide us with those resources. There's also an ability for our members themselves to add resources. So we're always encouraging members to add resources. The e-learning also, there are around 200 e-learning materials, and 20% of those are in French.
So we posted a variety of webinars. Since about September of last year, we began hosting bi-weekly webinars on a variety of topics, and some of them are shown here, but these have been on topics related to health equity and diversity, Black experiences in healthcare, thinking about ethics in the context of newcomer navigation, among many other topics. We also had a webinar series related to COVID-19, so addressing barriers to vaccination and what it looks like to welcome refugees during COVID-19. But we really have been taking the data and what we're hearing from our site visits and using that to inform our webinar topics. And I did see, I think it was a comment in the chat, or someone sent me a message just around using children as interpreters. And so we do have some upcoming webinars that might be of interest. And one of them is on the parentification of newcomer children, because we've frequently heard that sometimes children and youth are taking on tasks that are not normative for their age. So I do encourage you to sign up for that if you're interested in learning more. Our webinars are free to attend, and we issue certificates following them to support any professional development. If you're with a college and you need to submit those for professional development, we do have those. And then we also take whatever we talk about in our webinar and we move it over to the online discussion forum in our meeting place, so we can continue the dialogue there and encourage other attendees to share their knowledge and resources as well that they might have related to the topic. And recordings are also available. So if you register for a webinar and you can't attend live, you will receive an on-demand version of the recording. Upcoming, we have an upcoming N4 professional development series on trauma-informed care. And as the findings in this report really did bring out kind of the need for trauma-informed approaches in the health and in the settlement sector. And so this will be presented by the trauma-informed team at IWK Health Center. And it's a 3-part professional development series where there'll be interactive sessions. Unfortunately, it is full. It filled up really, really quickly, which I think just speaks to the need for this particular topic. But we are looking at ways that we can post it on our platform or host it again in the future. We're still thinking of different ways that we can make this content available, because we know that it's an incredibly important topic. And we also have ethics case-based rounds on a quarterly basis, and they're hosted with a bioethicist at CHEO, Dr. Michelle Mullen. And these are quarterly sessions, and we invite any professionals from the health and settlement sector to submit a case for discussion. And these are, there's a short didactic presentation, and then that's followed by reflective breakout rooms that are led by ethics coaches. And we have heard, as Sahar mentioned in the findings, ethical dilemmas were frequently brought up as a challenge that professionals were experiencing. So I do invite any of you who are interested in learning more about ethics or encountering an ethical dilemma to consider joining us for our next ethics case-based round on January 19th. And more information on that can be found on our website.
So our coming up conference, so this is going to be the first N4 conference. So, and thanks to P2P and all the organizers, we've learned a lot from them. And we have, we are looking to host it from March the 1st to the 3rd. The first and the theme would be around the past is practice, so intersectoral lessons learned from the dual pandemic of COVID-19 and systemic racism. Our hope is that professionals and frontline from both the healthcare and the settlement sector, and also from other sectors who have, you know, a lot of experience dealing with immigrants and refugees, especially during this time of the COVID-19 and the Afghan resettlement, they will join us. So the call for abstract has actually gone out, and we have accepted. We have received a lot of great abstract. We're still open for till the 15th of this month to receive abstracts, and we are looking forward to really providing a conference that would really meet the needs of the multiple sectors. The first day would actually be around workshops. So one of our hopes is to host again the trauma-informed care mini workshop on the first day. So stay tuned, but we are hoping to really have an interactive and a conference that would really provide you with lots of knowledge and meet a lot of your needs. One of the streams of N4 was actually to provide education through to the professionals from both sectors. So we partnered with a university here in Ottawa, University of St. Paul, who was really very interested in making sure that we have a program that's tailored towards the needs of our professionals. So again, given the results of the needs assessment, we provided all the data that we had from that, and we together worked on tailoring like a program, which is a one-year program that provides like 8 courses and 2 internship opportunities for participants from the healthcare and the settlement sector. So we to date have supported like 90 candidates to take this program, and the responses to the value of this education, what really information they were able to gain around the multiple issues around immigration, around ethics, helping immigrants and refugees during conflict, and dealing with disability. So what were the principles of social justice, and having candidates from both sectors really and across Canada really gave that we have a lot of ambassadors within organizations across Canada who has that education, and we were really pleased to follow up and see the impact of that education on themselves and their organizations, and hear from them how they've been sharing that knowledge within their own organization and even beyond within the sector. Another streamline that another project that we took on at N4 was creating a community of practice, so a national community of practice from both sectors. And we started in May by launching the steering committee for the community of practice. And we had then distributed a survey to get the sense of what topics should the members of the working groups work on. We had a lot of maybe 89 topics come in, arise, and we then themed them, and we are going to be working on two major topics that we believe, again, talk to the needs assessment and the results of the need assessment, the linguistic barriers. So we are going to be working on the accessing of the interpretation services within the healthcare and the settlement sector. We'll start hopefully beginning of December, and work on an environmental scan to create the existing research and the position papers on the costs, the benefits of providing interpretation services, and then communicate that. Our hope is that they would be able to advocate on the rights of interpretation to ensure equity and an equitable care to our newcomers and immigrants. The sector settling in Canada, as we all know, and it's one of the topics that's really now taking a lot. It's the it's a major intake that Canada has taken on just following the settlement of the Syrian refugees. So we're hoping that through that working group there will be a lot. There will be work around curating the existing resources from the health and the social services, and maybe adapting some of the old resources, and identifying also subject matter experts in the topic who could support the curation and the development or revamping of some of these resources. And again, this working group we're hoping would start in December.
Great. And I saw a comment just in the chat, Sahar, about the London and Middlesex LIP did a position paper in 2015 on access to interpretation and in medical settings. So I think it would be definitely great, Maria, if we can connect with you around that. We'd love to hear more about it and what the outcome was. So we do have a variety of subject matter experts that are sharing their expertise with our diverse network of professionals. So over the last year, we've onboarded over 15 subject matter experts from both the health and the settlement sector. And we've heard from a lot in academia that they're really wanting ways to pass their kind of the latest, the most innovative contemporary research and get it into the hands of professionals that can put it into practice. So our subject matter experts are involved with N4. They provide a lot of different webinars on topics of interest. It might also look like engaging them in a conversation that's happening on our online integrated discussion called Meeting Place, or if we as N4, if the N4 team receives an inquiry from a professional in our network, we will try to connect them to our subject matter experts so they're receiving their expertise on that particular topic. So if anyone is interested in joining the network as a subject matter expert, there's more information that can be found on our platform. So to date, we do remain committed to continuing to grow and expand our network. So the findings that we presented were from a period in time where we engaged with general hospitals and settlement organizations in government-assisted refugee cities. But more recently, we have been focused on partnering with national professional associations and umbrella organizations to help spread the word about N4. Now we have our platform has launched. We're welcoming members, and there's lots of great tools and resources that can be accessed. So we've really been strategically partnering with these organizations to help to get the word out and also involving them in some of our work related to our community of practice and in other areas. We also are looking forward to, for phase 5 of our outreach and engagement, we're looking forward to engaging with cities participating in the Rural and Northern Immigration Pilot Project. And we know that the needs of rural communities are different than urban centers. So we're really looking forward to hearing from professionals what different strengths and challenges they experience as they support newcomers. In terms of next step for N4, we will continue to work with our subject matter experts to develop educational resources based on that learning framework that Sahar explained earlier. We're also looking forward to launching working groups. So those working groups on those two issues, Afghan refugee resettlement and access to language and interpretation services, will be starting this fall. And there's more information on our N4 platform as well. We encourage anyone who has interest to reach out to Sahar or I about that. Our contact information is on the final slide of this presentation. And we also recently have launched our data toolkit. So we'll continue to collect information from organizations from the health and settlement sector about the services that they're providing to newcomers. And we'll also continue to update our public data page as well with different resources from CIHI and IRCC and Statistics Canada. There's lots of different data and infographics that can be accessed there. And I mentioned earlier, we'll continue to do further outreach and site visits. If you're attending today and we haven't met with you and you're interested in in connecting with N4, please do reach out and email us. We're always looking to grow and expand the network. And we're also looking forward to the launch of an N4 mobile app. So that is coming soon. It's currently in development, and we're looking forward to launching it really soon and hoping that it makes some of the features on the N4 platform more accessible to professionals, particularly those who might not be at a desk all day but might have their phone nearby. So we're looking forward to having features like our meeting place or that forum available on our mobile app. And finally, Sahar mentioned we're hosting our first intersectoral conference that will bring together both providers from the health sector as well as settlement and social services. So that's coming up, and we do encourage anyone who has an abstract to submit that for that conference. And I think we did leave some time for questions. So I'll just ask if anyone has any questions or comments or reactions to just either put those in the Q&A or the chat box. Sahar, I'll ask you a question just around the SEU program. If anyone's interested today in finding out information about that program, will there be a fourth cohort?
Yes, we are currently accepting calls for interest. So if there is an expression of interest, just kindly reach out and we can provide you with information around the SPU program, and hopefully we're still looking for opportunity for funding. So we hope to be able to host further cohorts in the future. And in our proposal to RSC, we're also looking at hosting that in French. So having cohorts who will be also supporting the French-speaking professionals. So that would be, I think it has been a demand and a need. So hopefully we'll be able to meet that demand and need also.
Okay, well, if we're not seeing any further questions, maybe we can go to the next slide, Sahar. And we just wanted to thank all of those who have participated in our virtual outreach engagement during this phase. It's really what we hear that informs our platform. So we're very grateful for all of those who took the time to engage with us. And also thanks to all those who tuned into the session today as well. It's really great to share findings from this report for the very first time, and we hope that it supports you in your practice. As well, if you're not already, it is free to join N4, and our membership is open to professionals from right across Canada, from the health, the settlement, and social service sectors, including academia and umbrella and national professional associations as well. So I will just put the link in the chat, and we hope to see you on the platform. And I'll just turn it maybe to Sahar. Do you have any
Yeah,
final words.
I would just want to say thank you very much to everybody who, again, they gave us from their time, especially with all the COVID-19 and all the changes and the going virtual and making sure that, still services are providing. So being very understanding and accommodating to N4 and still meeting with us virtually and giving us that opportunity. Sometimes we would meet for up to 2 hours with staff, and that was really, and managers, so in hospitals and the settlement organizations and with colleges. So I mean, like, thank you very much for making this report and informing the data in the report. It has helped us in what we're providing as N4, but also we are very open to any suggestions that you have today. Like, for us, don't hesitate to reach out if you have any ideas, anything that you feel that N4 can work on, as we are, trying to build this network from the healthcare and the settlement sector. So any ideas that you have for us would really be much appreciated. And we look forward to staying in touch through the platform and also through coming webinars and seeing you all at the conference. So thanks a lot. Thank you very much, everybody. Thank you.
Thanks, everyone.